So good morning, this is Dr. Dheeraj, consultant hand surgeon at Germenten Hospital. So today I will be discussing about a condition called as decurrent stenosynovitis. This condition is seen in the wrist. So what happens is, this is mostly seen in people having diabetes and thyroid problems, and it can occur with overuse of the wrist. What happens is, there will be pain in the wrist region. This wrist pain will come usually with overactivity, and this pain will be aggravated with movements of the thumb. So what is the reason for this problem? It is because of overactivity, as I told you, and there will be two tendons in the thumb. They are called abductor pollicis longus and extensor pollicis brevis. So these tendons travel through a small tunnel. It's called a extensor sheath. So while traveling through this tunnel, these tendons will become thickened sometimes in few people, like in diabetes and hyperthyroid patients. The tunnel will be very narrow, tunnel will become narrow, and the tendons also will become thickened. Because of this, the tendons will not glide freely, the tendons will not move freely. So this causes pain. So how do we diagnose it? We diagnose it by a test called Finkelstein test. So we bend the thumb forcefully towards the little finger. This causes severe pain in the wrist. This is one confirmatory test. There is another test called Eckhoff's test. We bend the wrist and ask the patient to move the thumb towards the wrist. So this also will cause pain. These two are confirmatory for decurrent stenosynovitis, and we can get it also checked by an ultrasound, which gives us about the inflammation or swelling in the tendon region, in the sheath region, and how many tendons are there in the first extensor compartment region. So what do we do? How do we treat this condition? Initially, we give painkillers and splint to give rest to the thumb. So we should not move your thumb over for a long time, for frequently, and we should not move the thumb. This commonly is seen in software people who use their thumb more, or people who use their mobile much. And this is the first stage of treatment. In the second stage, we give a steroid injection. If the painkillers do not work, we give a steroid injection or a PRP injection. PRP injection is much safer, and it has no side effects. This injection will help in 50% of patients. If the pain is still persisting, then we do a small procedure called as open release, decurrence release. We give a small skin incision over the wrist, and we protect one nerve called as superficial branch of radial nerve, and then release the tight extensor sheath, and we check the tendons which are moving freely or not. So this is a small day care procedure. We can come in the morning and can get discharged in the evening. So this is about decurrent stenosynovitis. Thank you so much.